Is there a volume kind of adjustment? Can you hear me now? Is that better? All right. So I'm Dr. George Isham. I'm co-chair of the Roundtable on Population Health Improvement with Dr. David Kindig. And on both of our behalfs, I'd like to welcome you to this workshop of the Institute of Medicine Roundtable on Population Health Improvement. I'd also like to welcome everybody who's joined us in person and those who will be joining us on the web. I would remind everybody in the room that this is going to be webcast and recorded. It'll be available in real time to people watching today, and it will be archived on the website and available for posterity in terms of making a more complete and total record about this extended conversation on the important aspects and features of what it takes to improve health of populations in this country. So I'm also very appreciative to those of you who will be speaking today and who have prepared, and look forward to that discussion. We will be taking questions and comments both from you in the room in the course of the day, but also hopefully from those of you on the web. If you send those in, we'll have an opportunity to see if we can get some of those to the microphone and get them into the conversation as well. Since February of 2013, the Roundtable has been providing a trusted venue for leaders from the public and private sectors to meet and discuss leverage points and opportunities arising from the changes in social and political environment for achieving population health. The Roundtable's vision is that of a strong, healthful, productive society which cultivates human capital in equal opportunity. The vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-based policies, dependable resources to achieve better health. As one of our major activities, the Roundtable sponsors workshop for members, stakeholders, and the public to discuss the issues of importance to improving the nation's health. And today's workshop is the occasion for such a discussion, and that discussion will focus on research. It's about population health science, and I'll explore the frameworks for understanding population health research, the factors that facilitate or impede research and its communication and use, and areas for future research critical to the advancement of population health improvement. We welcome those of you who attended yesterday's Population Health Science Conference, and I want to congratulate the Interdisciplinary Association for Population Health Science, which has this multicolored logo on the occasion of its inaugural meeting yesterday. And it's a real privilege for us here at the Roundtable on Population Health to join with others in making sure that event was successful. And I attended it. I know there are probably others in the room who also attended it. It was very exciting to see these young scientists and more mature scientists as well, not to focus on just the young ones, but really talking about some of the issues and some of the frameworks and some of the ideas that are necessary to advance population health science. So, congratulations. Excuse me. If you're tweeting, and if you're a Twitter user or Twitter participant, please use the hashtag #PopulationHealthRT as noted in the bottom of the agenda. If you have any logistics questions as the day moves on, please talk to one of the staff at the registration table and around the room. Alina Bachu is in the back there. We have other staff, Lila Hernandez here during the day, and as well as at the table. So if there are any questions or issues, please contact them. The meeting materials, including slides, sets, given to the staff in advance, and other materials will be posted to the meeting page after the workshop. So if you go to the website and want copies of the slide decks and other materials that have been submitted by speakers, they should be available within a few days. As we begin this day, I want to thank the members of the Planning Committee for this workshop, Paul Lance, who chaired the committee, also Lila Finney-Rudin, Michelle Frisco, Robert Kaplan, Phyllis Meadows, Bobby Milstein, Kathleen Mullen-Harris, and Lisa Simpson. Without the attention of a planning committee under a focused leadership, we don't do a good job in making these conversations come to life. So my appreciation to Paula and her team for making this day a reality. So with that, I'd like to turn to Paula and introduce her to you. She's Professor and Associate Dean for Research and Policy Engagement at the Gerald R. Ford School of Public Policy, University of Michigan, Professor of Health Management and Policy, University of Michigan School of Public Health, Chair of the Planning Committee, member of the IOM Roundtable on Population Health, and just a really decent person overall. So please welcome her.